Problem. What's the problem? What's the problem? Oh, very good evening, everyone. Yeah, so we're live now. So in today's live session, we'll go ahead with MCQs discussion. So before we start, I hope you guys are all ready. So did you complete your dinner? And also, by what time are you usually sleeping? Because we have 5 a.m. session. So how many hours are you actually getting or allotting towards sleep? So anyways, before starting session, Toffee was requesting me to give all the attention possible to her. But I said, no, Toffee, it's not possible because we have a live session now and we have aspirants waiting over there. So the attention has to be divided. Usually we say we should give undivided attention, but looking at this load of cuteness, it's difficult, isn't it? So I'm trying to divide my attention in such a way that I give 70% here and 30% here. I'm sure it works out. Toffee, is it okay? Say hi. Say hi to everyone. Hi. Hello. Okay, very good. Yes, it's better if you guys complete dinner by 8 p.m., at least 8 p.m. If not 8 p.m., 8:30 or maximum 9 p.m. Do not extend beyond that, because the more delay you have your dinner, difficult it will be for you to digest. And when you wake up early in the morning, you can even experience heartburn, isn't it? So try to complete off your dinner by 8 so that you'll have at least 8 to 9 hours or 10 hours of fasting, and you can restart your day with fruits and with various nutrients. Right. So first and foremost, a very good evening each and every one of you. So based on your replies to my query, I'm sure the streaming is going on fine. So in today's live session, as I mentioned, we'll have MCQs discussion. We're supposed to have it at 7 p.m., but since I was traveling, I couldn't really catch up to that particular time. So anticipating the same, we left an updates group this afternoon. So that we'll be conducting session at 9 p.m. and here we go. So hopefully this is totally different place. Hopefully we'll not have any streaming issues over here. And as I said, we always have a backup plan. Even if there are any streaming issues, we can always redo the session. In fact, we've redone the session 3 times yesterday, and third time, as I say, it's lucky charm. Everything went out very well. All we did is gave some time, isn't it? So, okay, I'm glad that some of you had dinner, some of you are getting 6 hours of sleep. So always keep in mind before we start our MCQs discussion, previously, I used to firmly believe that minimum 7 to 8 hours of sleep is mandatory, but that's totally wrong. Because wrong in the sense it's right in one context. Like if you're always worried, if you keep eating oily food, high carbs, no exercise, in that case, yes, 7 to 8 hours is mandatory. But if you slightly change your lifestyle, not drastically, slightly change your lifestyle, just practice meditation, do some workouts or minimum exercise, such as even walking for that matter. And if you change your diet, the amount of sleep quota decreases drastically. I've experienced it personally also. So 4 to 5 hours will be amazingly suffice, provided you make these changes. Or else with routine, couch potato, they say, that kind of lifestyle, if you get 4 to 5 hours of sleep, it's no way sufficient and it will be very much stressful. So it's not that you have to sleep for 7 to 8 hours. If you're smart enough, you'll alter your daily routine, daily habits, eating habits, and that will definitely help you reduce sleep quota. So even 4 to 5 hours would be amazingly suffice. So just keep that in mind. And I hope you guys are all ready. So let's go ahead with our dinner session, MCQs. Yes, first and foremost, this morning in today's 5 a.m. session, I've asked you a question like, what's the splinting time? So Dina has replied to that query through mail. Very good, Swadina. I'll get back to you through mail. So splinting time actually varies. So we have different types of splinting: semi-rigid, rigid, and non-rigid. And also splinting time varies from 1 week, 2 weeks, 3 weeks, 4 weeks, sometimes up to months, depending upon the treatment we're doing, depending upon the type of injury over there. Luxation, intrusion, extrusion, avulsion, the splinting time varies. So I asked you guys to find it. Also, I left one question unanswered. Rashmi Singh has answered this question, yesterday's question. That is, why is enamel thickness greater on lingual surfaces of maxillary molars and buccal surfaces of mandibular molars? You guys can try answering that question even now. So what's the reason for this increased thickness of enamel in those specific areas? So keeping these questions in mind, let's go ahead with our session and we'll try to answer them in the process. But the enamel thickness question, you guys can, I expect you guys to post your answer by the end of the session, or you can feel free to get back to me. So first and foremost, we have the following question. In case of cervical root fractures, splinting is done for duration of 1 week, 2 weeks, 3 weeks, 4 weeks, none of the above. And before you guys answer this question, please keep in mind 3 factors which I already mentioned in yesterday's 9 p.m. session or 7 p.m. session. First and foremost, consider each and every point very important. Assume that it's going to come in final exam. And second, do make note. And third, active participation. So post your answers and you can score your performance. So each question carries 4 marks, wrong answer -1, right answer +4. So maximum of 20 marks. So by the end of this session, you can present your scores for review. Okay. So I hope you guys are all following those inputs. So first and foremost, so we have the following question. So majority of you have chosen option D, which is quite interesting. Also seems reasonable. However, I'll give you another chance. Option D is not the right answer. So I've given you another chance for answering again. So as you know, root fractures, these are a bit complicated in the sense they're difficult to diagnose because clinically it's almost impossible to view them directly. So we need a radiograph. We need assistance from these equipment, X-rays and all. If not periapical, even occlusal radiograph, right? So in fact, literature clearly states that if the root fracture, suspected root fracture case is not evident in an IOPA, go for occlusal radiograph, which almost always gives you the clear-cut indications. So root fractures, depending upon the location of fracture, depending upon the displacement of the coronal crown or the coronal aspect of the tooth, the prognosis varies. And as you all know, apical third fractures have better prognosis compared to middle third and even more compared to cervical third. Worse prognosis, cervical third root fractures, isn't it? That's quite obvious. Because apical third, we can at least expect the tooth to stay within the socket, but cervical third, come on. Obviously, there we can anticipate displacement and prognosis is very poor. But having said that, we should not simply go for extraction. Rather, we should, if there is displacement, we try to reimplant under local anesthesia, and then we go for splinting. We have semi-rigid. Previously, it was all rigid splinting, which had its own drawbacks. Ankylosis and other functional related issues. But nowadays, mostly semi-rigid fixation, right, is being offered. In fact, fiber materials are being used. That's one of my first cases during my post-graduation, where I spent almost 2 to 3 hours. Unfortunately, there was debonding. The very next day itself, patient had to come back again. That was during my first year PG. So semi-rigid fixation allows functional movement. So that's the advantage we have with semi-rigid or a non-rigid kind of splinting. So as you know, splinting is something which we do to stabilize, right? So that's understood. So in case of cervical third root fractures, I'm glad you took the clue and eliminated option D. And it seems you sincerely follow my suggestion. That's very impressive. By the way, as you all rightly mentioned, option E is right answer. 4 months, if it is cervical third root fracture, splinting. See, different studies quote different values, but based on standard reference from which we picked up this particular question, it's a standard textbook. And if you're interested to know the name, do get back through mail. I'll let you know the name of the textbook. So my point is different authors quote different values. So if you have a standard reference, you can blindly go by the values given over there. So 4 months, rigid fixation in case of cervical third root fractures, as mentioned by authors. However, in case of apical third fractures or middle third fractures, splinting duration is, as you rightly mentioned previously, only 4 weeks, and you can go for semi-rigid splinting, right? So as majority of you rightly mentioned, yes, option E is right answer, right? I hope it's clear. And also, I took some literature, and I would like to discuss the same with you for your benefit. And see if you can get any additional points. If you think there are any key points, also we'll try to highlight. You can make a note of them simultaneously. Now that you know the answer. So management of root fractures in case of permanent teeth. See, deciduous teeth, first we'll start with deciduous teeth. No treatment is required if the kernel fragment is not displaced. We're talking about deciduous teeth root fractures. However, the kernel fragment is displaced, repositioning and splinting may be considered if patient compliance is good. Otherwise, the kernel fragment should be extracted. What if the kernel fragment is lost? Will you try to probe and remove the apical third of the root? It's contraindicated for the obvious reasons. That is, we have this succeraneous tooth, right? So there can be damage in the process of digging out this remnant apical third. So that's the context of root fracture management in primary or deciduous teeth. In case of permanent teeth, the management of root fractures and prognosis of affect tooth are determined by the position of the fracture, as I mentioned previously, apical, middle third, or kernel third, and also based on the displacement of the kernel tooth part. So if the root fracture is suspected, you go for IOP. If it's not evident over there, if you still have those clinical signs and symptoms, then you go for occlusal radiograph. And when you go for, should you go for root canal treatment? Please do answer this question. In case of root fractures, I mean, you've done splinting, okay, everything is set. Is root canal necessary? If yes, when? If no, why not? So consider this as your homework question or critical thinking assignment, okay? So I hope it's clear. Now, yeah, let's stop it here. We still have extensive information out there. Anyways, let's not dwell too much into it and let's move on to the next question. Okay, I hope it's clear. Now, let's move on to the second question. Image-based question. So identify the instrument. Contouring pliers, separator placing pliers, forceps, none of the above. So which one do you think is more appropriate answer? By the way, those who have answered option E for the first question, do award yourself +4. So identify this instrument. So what could it be? You can see the handle, which has been adapted in such a way that it nicely conforms to the palm of dentist's hand. And the tip is not so clear in this particular illustration, but I have another image for you. I'll present it, okay? Yeah, in a few moments after you answer this question. So identify this instrument: contouring pliers, separator placing pliers, forceps, none of the above. So which one do you think is a more appropriate answer? Yeah, most of you are getting it right. Very good. Impressive. Okay, so first of all, this particular instrument, as you can see, it is single-ended, right? It's not double-ended, it's single-ended, and which is pointing towards counterclockwise position. So it's a single-ended instrument, and you can see the handle conforming to the shape of the palm for your convenience of handling. And it is used for placing elastic separators interproximally. I'll show that image as well. So now I've given you the answer. directly or indirectly. So it's, as you all rightly mentioned, majority of you, separator placing pliers. Option B is right answer. So separator placing pliers, they're used for placing elastic separators interproximally. They're single-ended instruments available in different sizes and shapes, and the handle is adapted for a palm grasp. Okay. Now, let me show you another illustration of the same instrument where you can clearly see the separators. I hope you can see. Yeah. So these are separator placing pliers. Okay. So once you observe this illustration, you're never ever going to forget this, at least till the date of exam, isn't it? Okay, I hope it's clear. So as majority of you have rightly chosen, option B is right answer, and please award yourself +4. Well done. Okay, now let's move on to the third question. Let's see how many of you are going to answer it right. The most common form of diabetes in children. I'll also give you the age range, 5 to 15 years. The most common form of diabetes in children. Type 1, type 2, type 3, type 4. So which one do you think is more appropriate answer? Now don't ask me what type 4 is. I've just given you the numbers. It's up to you to answer. So anyways, as you know, we have 3 types of diabetes, type 1, type 2, and gestational diabetes, which is diabetes seen in pregnancy. I'm sure you're all aware of. So type 1, insulin dependent, type 2, non-insulin dependent because of resistance, lifestyle changes. There are so many factors, multifactorial in fact. So which among them, in fact, I mentioned gestational diabetes in pregnancy, right? So by the way, there is no such option here. Maybe type 3, no. Anyways, according to CDC, gestational diabetes. So type 1, type 2, and gestational, 3 types of diabetes. So the most common form of diabetes in children is, yes. Sana seems to be very much interested in knowing the cutoff of Haryana PSC. Sana, I have no idea. I'm really sorry. If I had any information, I would definitely let you know. I've seen some of the questions which our students have mailed me for review, because there was an option for you to submit corrections till 2 p.m., I reckon. Sonali was mentioning the same to me. So I have no idea about the cutoff, but I've seen the questions, good quality questions. And if I have any information, Sana, I'll definitely let you know. Please do participate in the session. Don't worry about cutoff. Okay, I'm sure you might have done well. So as majority of you have rightly chosen, option A is right answer. Very good. So type 1 diabetes. So let's look into some of the features of type 1. Just for sake of review, you can consider this as literature review, and you can make a note of any important points which you think you'll come across. So type 1 or insulin-dependent diabetes mellitus is one of the most common form of diabetes in children. So between ages 5 to 15 years, the suspicion of diabetes usually arises by one or more of the following clinical symptoms. Family history. In fact, in one of my in my family, one of our niece, she had this type 1 diabetes. We were all in shock. Of course, yes, there was family history. So family history, symptoms like polydipsia, polyuria, polyphagia, but with weight loss. Enuresis, difficult to control the bladder. Recurrent infections, candidiasis, etc. Glycosuria, ketoacidosis, coma are also possible when it goes uncontrolled, and also most frequent with type 1. So we have various clinical signs and symptoms, which gives us the clue. So subjective findings include a history of polydipsia, polyuria, polyphagia, and weight loss. A fasting blood glucose level above 120 milligrams per deciliter is indicative of type 1 diabetes mellitus in children. Periodontal disease is one of the most consistent oral findings in patients with poorly controlled diabetes mellitus. You can make a note of this point. These patients exhibit increased alveolar bone resorption, inflammatory gingival changes, which may mimic clinical manifestation of localized aggressive periodontitis. So dentists play a very crucial role. during routine dental checkups, isn't it? Xerostomia and recurrent intraoral abscesses may be present. The goal of treatment is to control blood glucose to a normal level possible to avoid these complications of hyperglycemia, ketoacidosis, etc. And insulin is usually given as the part of treatment. And now I'll be discussing very, very important and key aspects, that is dental considerations or dental management of well-controlled diabetic patient. Please make a note of these points, but at least do pay attention. First and foremost, advise the patient to eat a normal meal before the appointment to avoid development of hypoglycemia, common sense. Second, if the dental procedure is anticipated to be stressful, consult the patient's physician for adjustment in insulin doses. Number three, consider utilization of prophylactic antibiotics, especially when you're going for surgeries, endodontic, periodontal therapies, to minimize the risk of infection, because they have this systemic condition. It's compromised, isn't it? And finally, have a glucose source available to treat the onset of hypoglycemia, if any. Right? So these dental considerations are very, very important. Also, very much helpful for you, not just in clinical practice. I mean, not just in entrance perspective, but also in clinical practice, right? So as majority of you rightly mentioned, option A, that is type 1 diabetes, is right answer. Well done, guys. Yes, very good. Now let's move on to the penultimate question, the diagnostic accuracy. In fact, Sana, this is one of the questions. It was reframed differently as a case-based question in your HP, Haryana Public Service Commission exam recently. So we were inspired by that question, and we tried to frame this question. So the diagnostic accuracy of which of the following pulp vitality test is high? This is something which I already discussed in e-classes, also in YouTube. This is one of my very first videos as far as I remember. So cold test, EPT, heat test, all of the above. So which one has highest or best diagnostic accuracy, or in terms of numbers or percentages, highest diagnostic accuracy? So I'm sure majority of you will answer it, right? But in the process, we'll also discuss some additional important points, right? As you know, cold test is something which is used for differentiating reversible and irreversible pulpitis based on response, subjective response. And heat test is something where we say, according to Grossman, only a positive response to heat test indicates abnormality, doesn't indicate anything about vitality. So I'm reframing those words. This is something which is mentioned in Grossman. EPT is something which is the best method we have. However, unfortunately, in case of young permanent tooth or immature apex, the results are not reliable, right? One of the false positives, false negative responses, isn't it? So false positive, false negative responses. Again, I reckon there was a question on the same in HPSC, recently concluded HPSC. Yeah. So which one do you think is more appropriate answer? Very good. So anyways, before I give you the answer, let me give you the percentages, which I already discussed in the video previously. The diagnostic accuracy of cold test is 86%. The electric pulp test is 81%, and heat test is 71%, based on several studies, as quoted, as mentioned in Grossman, 13th edition. Hence, clinically, a combination of cold test followed by EPT is recommended. Very, very important. And cold test can be used to differentiate between reversible and irreversible pulpitis, as I mentioned prior. In irreversible pulpitis, patients complain of increased pain secondary to heat test, while in such a situation, application of cold would cause temporary relief of pain. This is very, very important. Do make a note of it. And finally, heat testing is recommended when patient's chief complaint is pain in contact with any hot liquid or food, right? And as majority of you rightly mentioned, yes, Vinita has chosen option B. Okay, fine. So option A, cold test, is a right answer. You've seen the percentage, right? Do make a note of this percentage. Even if you don't remember the value, at least try to remember the fact that Toffee, you can't go anywhere. So we have a session going on. So cold test has highest diagnostic accuracy. Okay, yeah. Well done. So award yourself +4 if you have chosen option A. Now, final question, case-based, 9-year-old Kavita needs to get her left mandibular first molar extracted due to caries. What space maintenance treatment would you indicate or recommend? Band and loop, space maintainer, distal shoe, a removable partial denture, none of the above. So which one do you think is more appropriate answer? First of all, you have the following clues like the age, the tooth that's being removed. So these are the two major clues you have. So age of the patient, 9 years. So by then, so obviously first molars are erupted. In this case, there was caries, so you're going for extraction. We're not talking about alternatives to extraction. Extraction is being done because of grossly decay stature. So 9 years, which means the second molars are not yet erupted, 12 to 14 years, right? According to the timetable. So there's still time for second molars to erupt. So in the meantime, what are you going to do? What space maintenance treatment would you indicate? It's very interesting to see that you guys have chosen combination of options A, B, C, and D. Yeah, what would you do? So anyways, the good news is one of you is right because all the options have been covered except C. I don't know why you don't like option C. So maybe you are under impression that RPD should be given only to old patients. Might not be the case. So yes, well tried everyone. So let me give you the context. See, first of all, a second molar is not yet erupted. So you think we should give a space maintenance, but space maintenance in this particular case is not required because since first molar is being extracted, you would love to have the second molar erupt and drift mesially and cover up the entire space. That would be tremendously advantageous, isn't it? So keeping that in mind, space maintenance is not required. So let me give you, yes, very good. The second molar will drift mesially. Excellent. And it will cover up the space almost in majority of the cases, right? Excellent. Very good, Ipsita. Yeah, so let me give you the context. So if permanent first molar is extracted on a child before the eruption of permanent second molar based on age, so the best approach is to allow the eruption of second molar and mesial drifting to occur naturally. This will fill up the space most of the time. So space maintenance is not required. Okay, if suppose, let's keep this case-based question aside. If suppose you're given a space maintainer, so when do you remove space maintainer? What's the indication? So here is the point. A space maintainer can be removed as soon as permanent tooth begins to erupt through the gingiva. That's an indication. Also, depending upon the amount of root development, 2/3 of root development. So the most reliable indicator, please do make a note of this, the most reliable indicator of readiness of eruption of a succedaneous tooth and the need for a space maintainer is the extent of root development determined by radiographic evaluation. No space maintainer is required if eruption of succedaneous tooth is imminent, right? So these are additional points which I wanted to highlight. In this particular case, second molar, we wanted to drift mesially, as Ipsita and some of you rightly mentioned. Really well done. It's a very challenging question. And even if majority of you got it wrong, it doesn't matter because now you learned something and I'm sure you're not going to repeat this mistake, isn't it? Yeah. Okay, very good, well done. So option D is right answer. Now, we've completed our 5 questions. So what's the score upon 20? So how much did you guys score? Yes. So these are some of the questions. So in the meantime, you can just post your scores. And so these are some of the questions which I wanted to highlight in this specific live session. In fact, I was having a terrible headache before the session. You know, one of the advantages of doing things which you love is once you start doing things which you love, you'll have that kind of feeling which eliminates all these pathologies. You'll kind of have a rush which which allows you to perform at an efficient rate regardless of your personal health. So that's something which I always experience. And the reason why I'm telling you this is, when I say work based on your passion, choose a specialty based on your passion, do what you love, that's one of the added benefits you have. It doesn't matter how you feel, you're always ready to give your best, provided you're doing what you love. Isn't it? Isn't it? It's basic sense. It's common sense. It's a very simple logic. If someone is forcing you to do something, it's going to be a hell of an experience. But if you're doing it out of passion, out of love, and how do you know what's your passion? In fact, in the very beginning of our journey, I've shared some symptoms. There are certain symptoms like, if you're doing things in line with your passion, when you sleep, you'll have that sense of satisfaction every day, almost every day. And when you wake up, you'll have that sense of excitement because you know you're going to do something amazing, something you love, something which you're passionate about. So always keep these two symptoms in mind, clinical symptoms in mind. Sleeping with sense of satisfaction, waking up with sense of excitement. If you're experiencing this, you're definitely on the right path. But when it comes to preparation, this is not the case for majority of aspirants, unfortunately. That's the reason why I keep asking aspirants these questions. Like, if you're starting preparation, what's your driving force? Why do you want to prepare? Is it to impress someone? Is it to show off? Or is it for your own growth? I mean, once you start asking yourself these questions, these are tough questions. Appears to be very easy or simple, but these are tough questions to answer, right? Maybe it's easy to pose, but once you ask yourself these questions and when you try to explore answers, it's really very challenging. Because sometimes we try to hide behind the harsh reality, trying to beat around the bush and in turn inflicting ourselves, right? So anyways, keep asking yourself these questions. And once you have answers, like once you have clarity in what you're doing, that's the reason I keep on reminding that entrance preparation is not some sort of punishment and it's not some sort of imposition. This is something which you're doing for your own professional growth, including personal growth, because entrance preparation is something which helps you stay disciplined, enables you work hard, work consistently, and most importantly, it's something which you're doing out of your own self-belief. You believe in yourself. That's why you're giving your best and cracking entrance. So there are so many amazing things which you can learn simply through entrance preparation. Regardless of what rank or what score you have, finally, it doesn't matter. But there are so many great things you're going to learn through this journey. So keep asking yourself right questions or questions regarding your life journey, and the answers will definitely motivate you. Please don't do something just because others are doing it. Do or practice based on your love, in line with your passion, and that's going to be amazing always. So anyways, one of the reasons why you guys are asking for more live sessions is motivation, which I already know, but you reminded me the same in the recent poll which we conducted. So I'm trying to incorporate textbook reviews, MCQs discussion, image-based questions, topic discussions, we will try to slowly add up, including motivation. So I hope you're enjoying these sessions. As I said, I asked you to remember three things. One is assume that every point is important. Consider that this point is going to come in final exam. Second, maintain notes, active participation. That is, enjoy what you're doing, actively participate. So I'm sure you're finding these sessions helpful. And your feedback is almost always welcome. I hate to use this word because I always want your feedback, but sometimes some mischievous people use bad words and all. So in such cases, I block them simply. So anyways, your feedback is always welcome, right? So with this, let's conclude our live session. And by the way, let me just look at your scores. Okay, Sujay, if you started from question 4, you can just go back and You can post your score in the comment section once the stream ends, okay? Yeah. Yes, very good. Sarkar, even you can do the same thing, okay? Yeah, social dentist, Sujay, Swadino, Smriti, Kritika, Sumanta, Priyanka, Maheshwari, Priyanka. Okay, Rumi, Ritu, Rashmi. Yes, Danish, that's what we're trying to exactly do. Yeah. Key topics. Yes, from standard references, without any doubt. Right? So, by the way, Priyanka Gupta 8/20, your smiley is not appropriate at all because it doesn't matter how much you score. Okay, Priyanka Gupta, let me ask you this question. If I ask you these 5 questions again now, what's your score going to be? 8/20 or 20/20? Right? So it's okay to make mistakes. We all make mistakes. Unfortunately, there are people who act as if they know everything, but let's keep that aside. That's beyond the purview of this discussion. But there is nothing wrong in doing mistakes or wrongs, right? Because one learns through these mistakes. There's nothing to be ashamed of. There is nothing to feel sad about. Okay, so anyways, well done everyone, and I really appreciate your frankness in posting your scores as it is, because I'm not evaluating. Software is not evaluating. It's you who is self-evaluating. As I said last night in yesterday's session, the best evaluation for our own performance can be given by us, not by someone, not by any software. Even the software is technically right. No, our performance, we need subjective evaluation. When I say subjective evaluation, it's not my evaluation or your professor's evaluation in college. Again, it will be skewed. There are so many other nonsensical things happening in subjective evaluation. When it comes to your own evaluation, self-evaluation is the best method possible. Like a simple example, which I can give you is, before you sleep, ask yourself this question: how is my day? Not just about preparation, not just about number of hours you studied, not just about MCQs you practice, but how is your day? Are you satisfied? Did you exercise? Did you meditate? Did you spend time with family? Did you enjoy what you've been doing? And did you spend some quality time with regards to preparation? Of course, even that's important, right? So retrograde schedule is something which we advise, which I used to follow personally just before the exam, because that used to give me a tremendous bouts of confidence. So self-evaluation is always the best evaluation possible, isn't it? Okay, Vinita, good. Rish. Okay, social dentist, glad to hear that. Okay, guys, so I hope you enjoyed this session, and as I said, your feedback is always welcome. So I'll see you tomorrow morning in 5 a.m. club. So try to sleep early. I know this is something which is in the hands of BCCI nowadays, since IPL started. But anyways, try to sleep early, and I'll see you tomorrow morning at 5 a.m. And tomorrow evening, whether it is 7 p.m. or 9 p.m., I'll let you know in our updates group, okay? Yeah. Good night. Take care. Toffee, please wake up. The session is over. Yeah. Say good night. Bye. Good night. Okay, guys. Good night. Yavista, 9 p.m. Okay. You will see. In fact, YouTubers in YouTube poll, majority of you guys chose 9 p.m. But in Telegram, through slight marginal difference, a majority of you chose 7 p.m. So that's the reason why we said 7 p.m. initially. But if 9 p.m. is fine with all of you, then we'll definitely try to make it out. Yeah. Manju, you can, all of you, those who are not in updates group, right? For all regular updates, including notifications regarding dental entrance related exams, just drop a mail at proudtobedentist@gmail.com. you can access our updates group for free. Okay. Yeah. Good night, guys. Take care.